I'm Patrick Kamath. I'm a consultant in gastroenterology and hepatology at the Mayo Clinic and a professor of medicine, and I'm here to discuss our forthcoming article in the Mayo Clinic Proceedings entitled Magnetic Resonance Elastography, a novel technique for detection of hepatic fibrosis and hepatocellular carcinoma after the Fontan operation. And this article is with my cardiology, cardiovascular, and radiology colleagues. The Fontan procedure directs systemic venous blood to the pulmonary artery, bypassing the right ventricle. The procedure was originally described for tricuspid atresia, but is now used in many patients with single ventricle physiology. Prior to the development of the Fontan procedure, children with complex congenital heart disease were not expected to live to be adults. But nowadays, after the Fontan procedure, the majority of children get to be adults. Currently, we believe that there are over 1 million adults with complex congenital heart disease. In fact, there are more adults with complex congenital heart disease than there are children with complex congenital heart disease, and therefore cirrhosis or liver complications of the Fontan procedure are likely to be a big problem in the future. The downside of the procedure is that systemic venous pressure is high because the superior vena cava and the inferior vena cava are connected by a conduit to the pulmonary artery. This high systemic venous pressure results in passive venous congestion of the liver and ultimately in cirrhosis. And nowadays we see all the complications of cirrhosis in these patients that we see in other causes of cirrhosis, like ascites, variceal bleeding, hepatic encephalopathy, and we have even described the development of hepatocellular carcinoma. So the question really is, how do we follow up these patients who've had a Fontan procedure? Because by the time they're 30, about 1/3 would have developed cirrhosis. So Drs. Frank Setter and Dr. Johnson and their colleagues in pediatric cardiology decided to evaluate the role of magnetic resonance imaging and magnetic resonance elastography in these patients. Magnetic resonance elastography was developed at the Mayo Clinic by my colleague Dr. Richard Eman, who's also co-author on this paper. The technique of MR elastography is that mechanical waves are transmitted through the liver, and these images are captured, and the velocity of these waves as it traverses through the liver is detected. And the stiffer the liver, the more rapidly these waves will transmit through the liver. Therefore, a stiff liver is likely to be a fibrotic liver. So in this study, we looked at children and adults who have had the Fontan procedure to determine whether magnetic resonance elastography was a good technique to detect fibrosis. Liver biopsies were also carried out, and we noted that this was an excellent method to detect fibrosis in these patients. Moreover, we also detected hepatocellular carcinomas in these patients. Since an MR elastogram adds on just a few seconds to a standard MR examination of the heart, we think this is an excellent method to evaluate patients with congenital heart disease who have undergone the Fontan procedure long term. Typically, the risk of liver disease increases after about 10 years following the Fontan procedure, and perhaps this procedure needs to be carried out on an annual basis accordingly. However, at this time we are not certain as to exactly how often this procedure should be carried out after the first procedure. We also need further validation of this procedure. For instance, we know in other conditions a stiff liver is not always a fibrotic liver. For example, if there's inflammation in the liver can also become stiff. We wonder whether a congested liver can also become stiff. So further studies are going to be carried out in patients whom we do not suspect to have significant fibrosis, so that we can completely validate this technique as a marker of fibrosis. We're also trying to develop techniques to determine whether we can pick up hepatocellular carcinoma early but this is likely to take some more time and more investigation. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.